We told you yesterday about 2 deaths in the nationwide food-borne illness outbreak. And while the deadly cases are located in Michigan, more than 22,000 cases of cyclosporiasis have been reported in 45 states. Joining us now is Adrienne Walling, the prevention specialist for the Washtenaw County Health Department in Michigan. Adrienne, great to be with you. You are doing the on-the-ground work on this outbreak investigation. What does that look like day to day, and how does a health department prepare for something like this?
Well, I think the health department is used to pivoting. So while there is not necessarily any explicit preparation for a parasitic outbreak, we are very familiar on how to pivot. So when cases came in and when we started noticing that cases were much larger than usual, we knew how to pivot. We knew how to assemble our colleagues, our coworkers, to create a team to address and do all of the contact investigation. So typically our days currently include receiving all of the test results that we got overnight or over the weekend, making sure that we try to contact every single person to see if they have any questions, give them information on tips and tricks on how to feel better, important information like staying hydrated and hand washing and produce washing information, but also asking them questions to see if we could figure out commonalities on how people got cyclosporiasis.
Yeah, you talk about pivoting. Specifically, what are you doing to track and trace this outbreak? Does it involve going to grocery stores, going to restaurants, going to people's homes?
So at the health department, there's a lot of different areas and organizations, both at the state level and at the local level. Environmental health goes to the grocery stores, contacts restaurants to do their investigations. On our end at the health department, our nursing team and myself are talking to people who have gotten ill. So we see what they have eaten. Sometimes that could be challenging since we have to go back 2 weeks prior to when they got ill to see exactly what they were eating, what produce they had, if they went out to eat, if they didn't go out to eat, where they go to their grocery stores. So it's really involved. The conversations take a lot of stamina. Sometimes they could last anywhere between 40 minutes and an hour. So they can be very involved. Also, they take a lot of time and care because these people have been ill and they're not feeling well. So it does take a lot of time and care to make sure that they're doing okay as well.
What about tracking down the ultimate source of this outbreak? It was a lot of different information coming from a lot of different places. First said it was a link to a farm in California. Others are saying it was linked to a farm in Mexico. Why has it been so challenging to find the source of all of this?
I think one of the big reasons why it's so challenging is because of the parasite itself. Cyclospora, it does take anywhere from up to 2 weeks to get someone to be ill. And not everybody seeks care immediately after they start feeling ill. So sometimes they're seeking care a week or two later, then they get tested. So it takes time for the test results to get back. And then that triggers our initiation to investigate what got them ill. So sometimes we could be asking someone what they ate a month ago. So, it is very hard to recall and remember the food that you ate a couple of days prior to the 4th of July. So that's why it really can get tricky narrowing down sources, especially because we have so many cases. So we're going through and we're talking to Washtenaw just passed 1,000 cases in our county alone. So we're talking to everyone, and then it takes time to analyze the data from our conversations.
So where are we now in the outbreak? Are you starting to see less cases, or do you think it's going to get a little bit worse before it gets better?
That's a great question. Right now, what we're seeing is, thankfully, the people that we're talking to now, they were sick weeks ago. I know that doesn't sound great. However, that means that people are not getting sick now. So that is a great indication that things are getting better. However, just the sheer amount of cases have really overwhelmed multiple healthcare ecosystems. So what we're seeing right now is people who have gotten sick weeks ago, got tested weeks ago, but because of just the sheer volume of tests, labs are being delayed in reporting. So we're actually getting results of people who were sick weeks ago. So while people aren't sick anymore, the work still goes on because we still do want to ensure that there's no potential sources out there still.
Talk to me about resources. Do you find that you have all the things that you need? Your team has all the things that they need to track and trace this outbreak?
We do our best. I think I really admire my colleagues, my coworkers, for their stamina, their grit. I work with many brilliant people, and we do the best we can. But I think staffing, is a huge issue all around, as well as just the disjointed, because this is not just our county and it's not just our state. Now it is a national level thing. There are many people involved in talking to each other. And that takes a lot of resources that many don't have.
Adrienne Walling, thank you so much for that insight. Great to talk to you.
Thank you for having me.